Welcome to the series Vitamins for Whole Health, short lessons on the vitamins that keep our bodies functioning optimally. I'm Thomas Lemke, registered dietitian and the clinical director of Whole Health. This installment is about vitamin B6. What is vitamin B6? This term actually refers to a total of six, yes, ironically six, common versions of a water-soluble molecule generally known as pyridoxine. Now again, remember, water-soluble simply means it mixes well in water and not in fats. Now pyridoxal 5-phosphate is the most common version of this in the human body. So what does vitamin B6 do? Well, pyridoxal 5-phosphate plays a role in the function of over 100 enzymes in the human body, including those which regulate or drive hemoglobin and amino acid synthesis, nervous system function, tryptophan metabolism. If you've seen the niacin portion of the video series, then you know how important tryptophan metabolism is for appropriate niacin levels, hormone function, and nucleic acid synthesis. There are several benefits to getting more than just the bare minimum amount of B6 in your diet, including that those who do enjoy a lower heart disease risk and a lower cancer risk. B6 is also used in the treatment of severe morning sickness during pregnancy. Other benefits are under study. The most crucial and time-consuming element is to control for other factors in the diet that accompany B6, like protein or fiber, to ensure that these benefits are attributable to B6 itself and not those other accompanying features. Among those conditions, it is being evaluated as being protective against, I can name depression, cognitive decline, and kidney stones as a few. What does a vitamin B6 deficiency look like? In the first place, it is uncommon, but it can happen in at-risk groups, which I'll name in a moment. Now, symptoms include microcytic anemia, which is that small red blood cells, not enough red blood cells, keeping your oxygen from getting to your tissues. We all know about anemia. Neurological symptoms like irritability, depression, and confusion, and of course, oral symptoms such as inflammation of the tongue and mouth ulcers. When it comes to at-risk groups, we're typically looking at situations where absorption is hampered or the vitamin is used up too quickly. Things like kidney disease or autoimmune disease. Now, autoimmune disease could be a situation where it's being used up too quickly, could also be an autoimmune disease, say, of the GI tract, like celiac disease, that would prevent adequate B6 from being absorbed. Those on certain medications, like those listed, are also at risk as they also hamper the absorption of vitamin B6. So how much vitamin B6 do you need? Well, if you're a male between the ages of 14 and 50, the recommended daily allowance is 1.3 milligrams per day. That goes up to 1.7 milligrams per day if you're 51 or older. For women, 14 to 18, 1.2 milligrams per day. When you get into the 19 to 50-year-old bracket, that goes up to 1.3 per day. And over the age of 50, that is 51 plus, you're looking at 1.5 milligrams per day that is needed. As far as sources you can get that B6 from, beef liver, tuna, salmon, fortified cereals, chickpeas, poultry, and some fruits and vegetables such as dark leafy greens, bananas, oranges, and cantaloupes. And of course, you can enter a search online and find more options as well. As for a B6 toxicity, there is a toxicity for this water-soluble vitamin. Believe it or not, I know that's uncommon. The tolerable upper intake level is 100 milligrams per day, and that's what has been set to be safe. In all actuality, when we do see these symptoms of toxicity show up, it's typically from people taking well more than that and over a longer period of time, because it is only achievable by supplementation, not something that you can achieve with diet alone. Just categorically impossible. Pyridoxine supplements are particularly in question here, as too much pyridoxine has shown the maybe strange ability to hamper and dampen P5P, that pyridoxal 5-phosphate that I mentioned earlier, dampen its production in the body because, of course, different forms of pyridoxine do have to be converted into that P5P molecule in order to be used in your body. And again, with too much pyridoxine, you end up with a paradoxical deficiency of P5P because too much will again shut down that conversion. Thank you for watching the vitamin B6 entry of the series, Vitamins for Whole Health. We'll see you next time.